Hi, I'm Dr. Tracy Marks, a psychiatrist, and I make mental health education videos. I've gotten a lot of questions on the issue of how to tell the difference between anxiety and mania or hypomania. I'll use the term mania, but everything that I'm saying also applies to hypomania. Anxiety disorders can occur along with bipolar disorder, and there is some overlap in the way that anxiety and mania look that's not always clear which is what. Why does this matter? Because one of the ways that people can remain stable with bipolar disorder is to recognize early signs of either depression or mania so that you can intervene early to prevent the episode from blossoming. If a manic episode is coming, that intervention is most likely adjusting your mood stabilizer, but you don't want to do that if it's anxiety. Here are the symptoms that can look similar with anxiety and mania. Racing thoughts, communication problems, mood irritability, inability to sleep, restlessness or agitation. Before we break these down, let's look at the general difference between anxiety and mania. Anxiety is a feeling of uneasiness, fear, or dread. It can have physical manifestations, but it starts with a feeling. Mania is a state of hyperarousal. Imagine having an internal motor and someone has turned up the dial on the motor. There may be emotions attached to this hyper state, but it starts with a physical speeding up. So in some ways, anxiety and mania can be thought of as having like opposite directions. Even though they share some of the same characteristics, with anxiety, the feelings converge upon you and affect you physically. And with your mania, your physical state explodes your feelings. And that's just a rough cheat sheet way to think about this. But with that understanding, let's look at these symptoms. And for the purpose of this video, I'm going to focus on generalized anxiety, where the main manifestation is being consumed by worry and fear. Generalized anxiety disorder is one of many anxiety disorders like panic disorder and social phobia. So first we have racing thoughts. With anxiety, you have trouble shutting off your worries and you overfocus on a perceived threat. I talk about what part of the brain causes this problem of not being able to shut off these thoughts in this video on brain games to help anxiety. Take a look at it. I think you'll find it useful. So the anxious person can worry, fret, and experience intrusive thoughts that you can't get out of your mind. It can feel as though you have a recording of yourself talking about these what-if scenarios and you can't turn off the recording. It can keep you from falling asleep. It can distract you from paying attention to things in the moment. With mania, because the dial on your motor has been turned up, you have this increased energy that makes everything move faster. You are producing more thoughts that you feel like you can't keep up with. Imagine a time-lapse video of a flower that's blooming and the petals just keep coming. That's how your thoughts can feel. And the theme of what you're thinking isn't necessarily fear or worry. You can have ordinary thoughts that are just processing faster. And just as the thoughts are moving fast in your head, your speech usually reflects the speed of these thoughts. You speak with a fire hose of words. We call this pressured speech. It's hard for someone else to find a natural break in what you're saying because it's just one run-on thought after another. And also, because of the increased energy that you have, the manic person may be speaking louder. So the anxious person is usually suffering silently, or they may be verbalizing their worries, but they aren't talking as loud and fast about the things that they're worried about. Next, concentration problems. Worry and fretting interfere with your focus. You can't filter the thoughts in a way to be able to give your full attention to something else. You can have a similar problem with mania because your thoughts are blooming fast, but the main difference here is that the focus and concentration problems exist inside of mania. And when your episode resolves, you stop thinking and talking fast and you're back to your baseline level of concentration. Anxiety is a condition that lasts longer and tends to be more of a chronic issue. Anxiety comes and goes in waves over the course of your life. You may have seasons where it's worse and becomes unmanageable, and then have quiet periods where it's not so bad. Since you don't become completely anxiety-free, your concentration problems may persist to a milder degree when you're not as anxious. So with anxiety, your concentration problems can get worse and better depending on how anxious you are. Next is mood irritability. Anxiety is a state of distress. It's very unpleasant because your brain is staying in a state of threat awareness. This can make you irritable and edgy. With severe anxiety, some people can even become depressed. Mania creates a certain level of disinhibition. You're not able to control your emotional reactivity. And just as the dial on the motor is turned up, so is the sensitivity dial. Like the gain on a microphone, it doesn't take much to move the needle too far in one direction or the other. So you have more raw, unfiltered emotional reactions. So it doesn't take much to transform your good or even elated mood into a grumpy or angry mood. Inability to sleep. With anxiety, your worry can keep you awake such that you have trouble falling asleep and staying asleep. Not every anxious person sleeps poorly, but your sleep can be an indicator of how severe your anxiety is. If you don't sleep well because of your anxiety, you feel run down, especially if it happens multiple nights in a row. With mania, you don't have much need for sleep. You may only sleep 2 hours because you were up reorganizing your shelves. But you can still feel energized from these couple of hours and can even do that several nights in a row without much problem. Last is restlessness or agitation. Agitation is a physical state of excessive movement. The anxious person can have physical symptoms of the anxiety, like feeling tense or even breathing faster. And you may feel like you can't relax, so you need to pace to deal with the tension that you feel. On the other hand, the manic person has the dial turned up and has more energy pushing them to keep moving. If you watch a manic person, they're less likely to look like they're pacing out of worry and angst. Instead, they may look like a busybody, doing this and doing that, kind of like a worker ant. Now, an exception to this is the person with mixed mania and depression, who may be tired from the depression, yet wired and amped up from the mania. That usually looks like an irritable, miserable person. The person with pure anxiety may be stressed and worried, but not sad and miserable, unless they've slid into an anxious, depressed state. So there's a lot of nuances here, but I think you can get a general sense of the way an anxious person looks compared to a manic person. Of course, you can have bipolar disorder along with anxiety, and usually the anxiety worsens either the depression or the mania. And it becomes tricky to treat an anxiety disorder when someone has bipolar disorder because the antidepressants that we use for anxiety can make your bipolar disorder worse. So the solution is one that your doctor has to give careful thought to. What medication is best to use is completely an individual one based on your history of medication response. And it may be the case that therapy for anxiety is the better approach to manage the anxiety and use the medication only to treat the bipolar disorder. I hope this was helpful for you. Take a look at this video that I did on modifying your attentional control as a way to help your anxiety. See you next time.